At Kharadar General Hospital in Karachi, Dr. Shakil sees patients in the pediatrics ward, the overwhelming majority of whom come in complaining of diarrhea, largely contracted because of poor feeding habits.
The bottle is, in my opinion, really a curse in our part of the world, where there's so much of environmental pollution. Even after having sterilized them, the bottles can be left open. The same dirty bottle would be put into the baby's mouth without, even perceiving that it might have become infected.
All newborn babies should be breastfed. But in Pakistan, unfortunately, because breastfeeding is not widely common, at least not exclusive breastfeeding to newborn infants, we do see a fair number of cases of diarrhea in the later part of the newborn period.
Most of our mothers give up breastfeeding because of the fact that they think that they are not being able to provide enough. And this is a perception which is not right most of the times.
Unfortunately, very few people in rural populations or less literate populations give the baby the foremilk, what is called colostrum. This is the thick milk that the mother has in the first few hours to, let's say, first 24 hours after birth, which is specially designed by nature to give this baby a sudden natural boost of immunity. This is the most potent natural antibiotic known in nature. And yet the tradition in many rural communities is to discard this milk because it's regarded as stale milk.
According to the recently conducted Pakistan Demographic and Health Survey, at 78 deaths per 1,000 live births, Pakistan's infant mortality rate is higher than rates in India, Nepal and Bangladesh.
I think if you exclude Afghanistan, Pakistan has the highest rate of child mortality amongst the South Asian countries. But the sad thing is that the progress in terms of improving child survival in Pakistan has been much slower than many other countries. I mean, take Bangladesh. At the time of the 1971 conflict, they started off in a much worse shape. And today they have indicators which are virtually 2/3 of that of Pakistan.
The majority of these deaths occur because of birth asphyxia.
Birth asphyxia is caused by when the baby doesn't get enough oxygen at birth and a baby has a cord around the neck and the child has asphyxiated. It's a complication of delivery. It's common in the community because they're delivered by the TBAs, traditional birth attendants.
So as you can imagine, the newborn period, the first 4 weeks after birth, are the most critical. And we lose roughly close to around 57–58% of our children in that time period. Why? Because a large proportion of our births take place at home. And that's a huge challenge because you cannot get enough interventions to people when they need it most. And babies, when they die, will typically die in the first few days of life.
Umbilical infection is common just because they're home delivered and they don't clamp the cord. And they put a lot of things over it, like surma over the cord. They put haldi and they put cow dung even. Yeah, it's a tradition. I've seen babies myself, like literally soaked with surma. I had to clean the surma first, then I could see the cord. This is red and infected.
Apart from birth asphyxia, sepsis and diarrhea, pneumonia, which has been dubbed the forgotten killer, is one of the leading causes of child mortality in Pakistan.
People have forgotten how serious it can be. In a worst case scenario, if a child contracts a severe pneumonia, they can expire within as short as 24 hours.
Pneumonia, I'm afraid, is much less in one's control as diarrheal diseases.
At the Indus Hospital in Karachi, Dr. Amir Khan is leading an award-winning pneumonia project through which they hope to influence policymakers to introduce a vaccine that can prevent the disease. If we have the technology or the information available to prevent things like pneumonia, why is it that over 2 million children every year die from pneumonia?
Because we have a couple of very good vaccines that actually prevent death, but they're either very expensive or they're very hard to get to the areas that we need to get them to. So it's not simply the absence of a technology, it's a whole health delivery system that needs to exist and be in place as well. So the specific pneumonia research that our team is doing here based at the Indus Hospital is focused around preparing ourselves for a vaccine evaluation. The new vaccine that we're interested in is a pneumococcal vaccine, so it prevents against a particular type of bacterial pneumonia. The problem at this point is that it's a very expensive vaccine. So clearly, before Pakistan can decide whether that expensive vaccine needs to be introduced into our regular routine immunization program, we would want to know whether it's the right vaccine for Pakistan, because it costs a lot of money.
This pneumococcal vaccine could be a potential silver bullet in the treatment of pneumonia in Pakistan. And after the break, we look at how the project is hoping to bring this about.